So a couple of things, first, let's get down to the basic. You see patients almost every day, and you see a lot of melanoma patients. What do you tell them when they first walked in, when they're sort of just so scared and terrified?
I think you hit the nail on the head with the prompt and the question is, you know, uh, every patient, every patient. I think the most important thing that we do as clinicians and as doctors, we have to confront and recognize the human factor, the humanity in sort of that interaction. Yes, we're talking about melanoma, but actually what we're dealing with is what is that emotion, what is that forefront concern? And you're right, oftentimes it is worry. It's worry about sometimes it's worry about the unknown. Sometimes it's worry about knowing too much, right? We think about all our
Hmm.
patients who have access to the internet and Google and all the different rabbit holes that they can go down. And so I always start my conversations with I want to hear what's going on in your head. Tell me, what is it that you're thinking about? What's consuming your thoughts? What are you worried about? What are you scared of? What are you uncertain about? Let's start there. So it's never, I'm going to come in with my agenda and let me tell you about melanoma and what we're going to do. It's more of an inquiry of, I want to know where a patient is coming from. Everybody comes from different places. They're what they bring to the table and into their interaction there. And I think if we don't start with the core, what's most important, we won't get far. And so that's always how I start my encounters. Melanoma or anything, but particularly when it comes to cancer, and particularly when it comes to melanoma.
No, I think this is really important. We think we know, right? But in reality, we don't sometimes. And I think it's a lot better just to ask patient to tell us what's on their mind versus guessing. And I think there's something else you do this is a very, very powerful exercise. Just take a couple of minutes to sort of get them to build that trust, right? And once they feel they're being heard, and you form that bond, because then the patient will come back and you will listen to you and increase the efficacy. But no, okay, you listen to them at this point, right? And what do you tell them?
I think
Uh,
listen, yeah,
Go ahead. After you listen to them, then what?
yeah. I think once we understand where that place of starting is, then it's kind of what I like to do is I say, this is where we're trying to get to. So we have where we start from. We have sort of what it is that we're going to get to from a high level perspective, which is that we've addressed the issue that's foremost right in front of us, right? This acute situation that we're in. Usually, it's a new diagnosis of melanoma. And we say, yes, we're going to address this. We're going to talk all about the details. We're going to answer all of your questions. I want to first talk to you about where we're going to get to. Where do we want to end up? We want to end up in this place where, we look back and we see, yeah, we traveled that journey. We're in a place where we're more aware and understanding of skin and cancers, why they exist, and we're empowered with all of the knowledge that's going to help us live our lives in a meaningful, full way. That's also cognizant of the risk going forward. So we will get to a place that is much different than where it is that we're starting. We're going to feel not scared. We're going to feel in control of our skin. We're going to feel in control of all the things that we can do that will help prevent or reduce the risk of skin cancers or the skin cancer melanoma coming back. We're going to do this in partnership. We're going to do this together, and that's where we're going to end up. And so what our path is how do we get from where we are today to that? It's not one visit. Sorry. It's a journey, it's a relationship, and we'll get there. Today we're going to focus on this. So I like the idea of, let's look at the big picture. And this is what we're aspiring to, because it takes away a little bit of the here and in the here and now. It's overwhelming at times, right? Even for us clinicians, Steve, sometimes we see complicated situations in patients where there's so much to go through, and we're never going to get through it in a visit and be able to answer everything and talk about all the different risks and benefits of this and that. And but it doesn't have to be all in one, right? It doesn't. I think there's a common misconception that, hey, got to get it all done in that one visit. It's not true. It's the start of a relationship. It's the start of a dialogue, and it's the start of a journey and a path. And so that's what I like to do after I listen.
Yeah, I always sort of acknowledge the fact that, this is, I always tell my patients, especially the ones that just got treated with melanoma, right? And when just diagnosed, got surgery, etc. And they're coming back for skin exam. And I always tell them, I know you have all this concern and fears, everything, but over time, you're going to get better. Time
Mhm.
heals, right? And then also that every time they come back, they see every year they're coming back, the melanoma is not coming back once they reach the magic 5-year mark, their risk just goes down. And there's the psychological comfort they achieve over time.